Okay, tell me what you need me to do.
No, we're just.
Okay.
You're totally fine, but incisions look like they're healing up great.
This one.
And so.
This one is super bruised, really.
Yeah.
Hurts. Is that the bigger one? Or?
And there's still. I think I'm not sure why that one would be more, but there's still dissolvable sutures underneath there, and so.
Underneath the skin.
Yep, so they'll go away.
Oh, okay. I just took those off. The ones you gave me about 3 days ago.
Perfect. Yeah, it's okay to still shower, wash with soap and water. Just be kind of gentle with them.
Okay.
We try to avoid soaking in lotions for 4 weeks. Just make sure they get all healed up before you do that.
Okay, got it.
But
so 3 more weeks. Okay.
Otherwise, we stick with the sling. Okay to move the elbow up and down. You can lean over at the pendulums, let your arm hang a little bit.
I did that.
But no active moving your shoulder. So really want to keep this relaxed.
Okay. And then what else? I was going to ask you something else. Yeah, I was helping myself and now, but I could do it on its own now.
Mm-hmm.
How do you know if you have locked shoulder? Because I could do this right now. If I had locked shoulder, I wouldn't be able to do that, or what are the symptoms?
If you had a frozen shoulder going forward, yeah, and so it would just be stiff when we start physical therapy.
Oh, so that's when I'll know?
Normal to get some stiffness. That means that things are healing and
is that what
some
that
scar
means?
tissue.
And stiffness would be what, like when you raise it?
So we don't want you doing that.
No, but would it be when I do that? That's when you know you have locked
That
shoulder?
will be something that could occur as time goes on in the future. But
it could occur in the future as well?
You shouldn't be moving your shoulder at all right now, basically.
Okay.
And so when we start stretching the shoulder out, it is possible to get an adhesive capsulitis after surgery.
Oh.
That is something that sometimes we deal with.
Okay.
Most people don't have it.
Okay.
Everybody gets a little bit stiff. You should get stiff because you had surgery and your shoulder is trying to heal something.
Okay.
And so stiffness is normal. Usually we work through it with physical therapy.
Okay.
It's not a big problem for most people. Just stretch it back out.
Okay.
Sometimes we do have to manage it otherwise, but that's not something that we test today.
Okay, got it. Okay.
We just let you heal for now.
For now, okay. And physical therapy isn't for after 4 weeks?
Typically we start 4 to 6 weeks from surgery, yeah.
Okay. And if I'm not ready in 4 weeks, I can wait 6 weeks? I just don't want it to re-tear.
Yeah, and so the initial part is passive motion, and so somebody else moving your shoulder, and so that should be very low risk. It's if you were to lift your arm up where it would
because I'm
pull
using
the
the muscles.
Exactly, yeah.
Got it. And what about shoulder shrugs? Is that
so
good
shoulder
to do?
shrugs, squeezing the shoulder blades together, those are perfectly fine and usually helpful when you're in the sling, makes it feel a little bit better.
Yes, that's what I was thinking.
But the muscles up here tend to get a little bit tight just because you're.
Yes, I'm very tight here, and I was going to ask you. So I have and it's gotten better, but right here it's like a bruise inside.
Yeah,
is that normal?
Common. Yeah, and so again, a little bit of squeezing the shoulder blades together and shrugging your shoulders can be helpful with those things.
Yeah, and then this was protruding out, and that's I'm assuming because it had some fluid in it, I think too.
Probably.
Okay.
But everything looks really good.
Okay, good.
Does the sling feel like it's fitting okay?
Yeah, it's good, and then I have one for the shower, and I put the towel just so they say people sweat, but yeah, But yeah, it's pretty good. And do you think that's about the right height?
Yeah, let's get you all strapped back up here. Where's the, okay. It looks like maybe
I think I put that on wrong this morning.
a little, do you undo it to do it, or?
Yeah, I do this. I mean, I must have done something wrong.
Yeah, it's looking a little off.
That's what I was thinking, because it felt twisted.
There we go. Did you undo any of the Velcros, or is this?
No, I didn't.
Okay.
I think, or maybe it was just put on wrong.
Let's see.
I don't know. Yeah, I joined this group on Facebook. It's a Rotator cuff surgery group. And there's a lot of mostly women. They're like, do you have bouts of crying? That's me too. Have you had any patients tell you that they're always crying because of all this stuff we have to go through?
This is
like losing an arm.
Not the most fun recovery for sure.
And it's just stopped all my activity.
Mm-hmm. Does that feel reasonable?
Yeah, it does feel better.
You're a little loose on this one. Do you want that?
Yeah, should that be tighter so it holds it up higher? Is that what that is?
Probably.
I didn't want to go too high because I didn't want to put pressure on the shoulders. So I think when it's down lower, it feels better.
We may just want to.
I think this is a man's brace.
It's one size fits all, and so
Oh, it is?
sometimes for smaller. Let's see. How does that feel?
I think I like it lower. I think when it's lower, that's why when I take my arm out of the sling, it actually feels like this part's just relaxed. Yeah, I think that's fine right there.
Would you mind grabbing some scissors?
Is it the higher the better, just to keep this intact?
What is comfortable to you is going to be just fine with this, but we'll just shorten this up a little bit so we can.
Okay.
But otherwise, I think if you're in a sling, I'm happy.
And then like when you came in, if I just have it outside the sling, that's okay too, just to let my arm relax. Is it okay to hang during
Okay to let
recovery?
it hang, yeah. Like again, as long as we're
As
not.
long as I'm not lifting it up. Because it does feel like it takes away the tension when I let it hang a little bit.
Is that okay?
Yeah. Okay, good. Okay, and then.
If you're happy, I'm happy.
Yeah.
So these are going to be all looking from the back of the shoulder toward the front. And so this is your subscapularis tendon, which looks totally normal, coming and inserting there. The biceps is the next thing that we see. Generally, you had the capsule and the biceps are a little red. It looked more inflamed, but not torn. And so biceps really looks pretty healthy. The tear is going to be right over here next to that. And so this little hole that we see and where it's all frayed. And then over on the back, it's the undersurface of the rotator cuff is attaching normally. And then when we look at the joint, nice smooth cartilage, no arthritis. Again, just looks a little bit irritated on the inside. All this redness is not normal. And so then we take a look inside the shoulder, move over to the subacromial space, which is outside the rotator cuff. So again, this is the hole, and so the rotator cuff attaching here, but this is the tendon that should be attaching onto the tuberosity.
That's the arm tendon?
This is your rotator cuff tendon.
Oh, that's the rotator cuff.
The supraspinatus. And then this is where it should be attaching. And so we put an anchor in, and then we...
those anchors,
we
that's plastic,
pass
right?
them through the, through the tendon. And then this is what the same view what the repair looks like, where we tie some over here and bring it over to a separate anchor to push the tendon down to the bone. And then it looked like there just wasn't a whole lot of space above where that acromion is, the bone up above. And so just shave that flat. So there's a little extra space so you're not pinching the rotator cuff.
Did I get 2 anchors on top and then 2 anchors on the side?
So
for a
one
total
and one,
of 4?
you had a pretty small tear, and so 1 and 1.
Okay, so full tear is the thing coming off your shoulder, the supraspinatus off the top. That's a full tear, but you're saying the tear was small.
So
See how I'm confused?
So there's the full width tear would suggest that this part is torn all the way, and then we also measure how far along it goes, and so all of this is still attached.
Oh, good. Okay.
And so, you had a
That's good news.
full thickness, kind of partial width tear.
Oh, got it.
Where,
Partial width. Okay.
Yeah, and so from here to here was torn, but from here all the way down to here was not torn.
Oh, good. Okay. Good.
And then the full thickness, meaning that the whole tuberosity, the tendon, full tear of the tendon, but part of the rotator cuff.
Okay.